So now that we understand Original Medicare Parts A and B was only designed to be essential coverage, only covering 80% of medical expenses, now let's dive into how to fill those gaps. The first way we started filling gaps in Original Medicare was through supplement plans, also known as Medigap plans. Supplement plans started around the year 1992, and they were designed to work alongside Original Medicare as standardized plans. So what does the standardized part mean? So there are a handful of Medigap plans, each one named after a letter of the alphabet, and the government made this standardized Medigap table, which basically means that a plan N from one company has to be the same as a plan N from another company. Same as a plan G, same as a plan K. Each plan that is named after a letter is the same as other plans named after the same letter. If you want to take a closer look at this table, see resource 7. It's all the supplement plans currently available. Here's an example to show how these plans work across different companies. So let's say we have two different insurance companies here, and they both offer a plan G. So both of their plan Gs have to be equal in benefits. This means that each plan G is filling the gaps in Original Medicare in the exact same way. And I'll show you how that works exactly later on. But the only thing that can be different is the price that they charge. One company may charge about $149 a month for this plan G. The second company might charge only $129 per month for this plan G. Companies usually decide what they're going to charge each year based on supply and demand. So this is based on how many contracts they sold last year, how many they would like to sell, or if they want to push a particular Medigap plan. Since you pay for a supplement plan in the form of a monthly premium, as you grow older, these premiums will rise, because the government and these insurance companies know that as you get older, chances are you're gonna need more healthcare needs. So it's not uncommon for us to see 80, 90-year-old people come into us and say, my supplement premium is astronomical. What can I do? And that's when we start to dive into other options. So you may be thinking, okay, I get that they're standardized plans named after a letter and that they're a monthly premium that'll raise over time. But if I choose to go the supplement route, how does my overall plan stack look? What am I actually paying for and what am I actually getting? So if you choose the supplement route, you will keep Original Medicare intact. So that's parts A and B from the government, which is only designed to be essential coverage. But then you will add on this supplement or Medigap plan with an extra premium. So think of this supplement line, the orange line, filling the gaps that are coming through Original Medicare. It's taking care of that 20% that you would have to cover otherwise. Now on top of this, it's really important to remember that supplement plans don't include drug coverage and they don't include extra benefits like dental, vision, hearing, over-the-counter, things like that. So if you're taking prescription drugs right now, then you're obviously going to want a drug plan. And if you're not taking drugs, you'll still want drug coverage, because the government says if you do not have creditable drug coverage when you actually sign up for it, you will incur lifetime penalties. So we're going to add on a prescription drug plan. Now this would be a separate premium, a separate deductible, separate co-payments, and even a separate card. So far you have 3 different cards with 3 different payment structures. Then on top of that, if you wanted extra benefits like dental, vision, or hearing plans, you'd have to have separate plans for those too, which would be separate cards and separate payment structures. So that's a supplement plan overview. Next, we will dive into Advantage plans. This is option number 2, and it has a much different structure in terms of costs and even benefits. I'll dive into how these actually work with real-life examples later, but right now I just want to give you a broad overview so you understand the difference between the two. If you ever want professional guidance from a Medicare expert, I, Braden Mosley, am a licensed insurance broker, and I'm contracted and trained and licensed with some of the top insurance providers in the nation, including United Healthcare, Health Alliance, Aetna, Humana, Blue Cross Blue Shield, Wellmark. If you decide to work with me, there is never a fee for my service, ever. I'll explain why later. I am only paid if I keep my clients, which means that my clients' satisfaction is my priority. And finally, I offer face-to-face, year-round service. If you haven't already, go ahead and download the 14-page fill-in-the-blank workbook that goes along with this course. It'll really help you increase your comprehension of the material. Whenever you're ready, click the button below to continue to lesson number 5, where I'll cover Advantage plans, how they work, what they are, and why some people think they are too good to be true.